Wednesday, February 5th, 2020. New York, New York, USA. On the first Wednesday evening of February, the U.S. Office of Golden Biotechnology attended their third networking event organized by LaunchBio, a non-profit that offers support to biotechnology and life science companies from the startup phase onto their growth and into later phase. This month's event theme was called Larger Than Life Science Power Getting Ready for Fundraising, and the discussions covered tips on fundraising, new techniques, and what pitfalls to avoid. Funding for early stage capital and how to access it are some of the most common concerns of early startup biotechnology companies. Eisner Amper, Republic, and Xontogeny were the guest presenters of the day. Angel investing, super angels, venture capitalists, corporate venture capital groups, sovereign wealth funds, family offices, hedge funds, and equity crowd fundraising were uncovered and demystified for the audience. Dilution was also a consideration that could help a company grow if you want to add new players to the management team. It is important to know what you need or have estimates of timelines so that investors feel comfortable in funding you. When doing multiple rounds of funding, make sure you don't run out of funds from the first round and plan ahead. Other topics included 1,202 stocks investors control when allocating ownership of the company, restricted stock clauses, pre-money valuation, and diverse online equity investments. Things to watch out for in the biotech fundraising space are overfunding, not learning enough about the angel investor who you are presenting to, lack of drug development talent, and the lack of investing in entrepreneurs aka the future zoos. The scientific researcher and drug development team are important to getting novel drugs off the ground. Instead of using old investment strategies, we could consider virtual management, outsourcing investment, and accelerated support for early biotech companies. Having attended this month's event, we may be better prepared for potential fundraising needs that come up in the future for our U.S. office as we continue to research and develop our novel drug for patients in difficult disease states.